Our guest today is Dr. Cynthia Thaik, Harvard-trained cardiologist, wife, mother of 3 beautiful children, owner and operator of 2 practices in Los Angeles, CEO and founder of Revitalize Youth, a nonprofit organization, owner of Revitalize You, a wellness center focused on health, wellness, weight loss, and detoxification. Best-selling author of this revolutionizing book, Your Vibrant Heart, Restoring Health, Strength, and Spirit from the Body's Core, as well as the spokesperson for the Vibrant Heart movement. Welcome, Dr. Thaik.
Thank you. So great to be here.
So glad to have you here. After listing all your accolades, I want to get to this book because I love this book.
Thank you.
But I have a very important question. When do you sleep?
Never.
That's what I thought. That is exactly what I thought.
You know, we all have the 24 hours, right?
Mm-hmm.
And so how is it that some people are able to create, and get so much done in that 24 hours, and others feel like they don't have enough time? For me, it's all about, again, just connecting and being present in the moment and allowing that creative juices to flow. It's about coming from energy and spirit and love.
And when you say connecting, connecting to one another, connecting to source, connecting to yourself, what exactly?
All of that, right? I mean, when we talk about the mind or the spirit, there isn't a million minds. There's just one mind. We're all connected. And you see this all the time in synchronicities that happen in your life.
Oh, so many synchronicities lately. Yeah.
And to me, those are all messages. Those are all downloads. And the more that you can live your life with ease, the more that you can trust and have faith that there is divine intervention that is guiding us, and that anything that happens in our life, okay, there is a good in it, right? And when you can come from a place of gratitude, really appreciating and being grateful for everything that happens in your life, because there's always something to be grateful for. I think that there's such peace and serenity in that. I really do.
And I love the title of this book. What does it mean?
Don't you love that title?
I do.
Your Vibrant Heart.
I do. What does it mean to live a vibrant heart?
It's so wonderful that you asked that question, to live a vibrant heart. Because for me, it's about the being. It isn't having a physically healthy heart or even having a vibrant heart. It is in the being, in the living, in the actual incorporation of that whole essence of life into your body that is going to dictate your actions, your feelings, your mood, your thoughts. Okay, to live a vibrant heart, to me, is to get back to the place where you truly see life as a wonder, of a possibility, that you live life from that place of innocence, of being able to imagine and to create, to have energy and spirit and vitality and vigor, life, love, joy.
Those things sound absolutely wonderful. You've created so much already. What is the next big thing that you see, part of your vision?
I really would like to see my book be a catalyst for change. Okay, and I want to be the agent of that change, but on a much grander scale. I so believe that there's so much more that people can have in life. Okay, I see patients all the time coming to me, and they have such stress in their life, and they're stuck, but they don't see a way out. They accept what they see as their current reality. And what I want to share with them, with my patients, with the readers, with the world, is that you can have so much more. Okay? It isn't about just having the physically strong heart. It's about having that spiritually vibrant heart, getting back to that energy, getting back to where life wants you to be. Okay? Where we talked about the children, having that energy and the spirit before all of our negative thoughts, all of our limiting beliefs, all of the things that pound us down has gotten us where we are currently. And so that's my vision, is to raise people and elevate them to that level of having hope for themselves and having peace for themselves. You know, we think with our minds, right? And when you ask people, where's your mind? They immediately go to the head, right? Well, your brain's in your head, but it's debatable where your mind is. And to me, the mind actually exists and it floats, right? And so the conscious mind sits up in your head, and that's where most of our talk is, right? We're sitting up here and we're analyzing, doing all that stuff. That's the conscious mind. But the subconscious mind, that's in our body. And it can exist everywhere, but where it mostly exists is in the heart. And so when we talk about being heart-centered, talking from the heart, feeling with the heart, you know, there's a lot of research that's shown that the heart itself and the cells has a lot of neural connectivity. Okay, and so there's actual neurons that exist within the heart itself that can actually have feelings. So it isn't just, you know, metaphysical when we talk about feeling with our heart. The heart actually has feeling.
So let's talk about what is your vision for not only your book, but, you know, for the information in this book and how it affects the rest of the world.
Well, here's the deal, okay? Heart disease is the leading cause of death among men and women. 1 in 4 will die of heart disease.
Staggering fact.
You know, compared to 1 in 30 dying of breast cancer. But it's interesting, right? Because you got the American Heart Association and the Go Red for Women campaign, and they're out there and they're doing a fabulous job of raising awareness. So it isn't from lack of awareness that there's lack of action. And in fact, the Cleveland Clinic just, you know, published a survey that they did of 1,000 men and women. And when we asked these people, are you bothered by heart disease? Are you scared of your heart, or are you concerned about your heart? 76% said that they weren't, that it doesn't strike them as something to be concerned about. And for me, my vision is that it's a different messaging from what is out there with the AHA and the American Heart Association and the Go Red campaign. I want people to be aware of these facts. Okay? It's important to know these facts. But I don't think that you get movement and action from a fear-based response.
Sure.
Okay? And so I don't want people to take action because they're afraid of dying from heart disease. I don't want people to come into my office, as they often do, saying, I got chest pain and I'm so afraid. I want people to recognize and realize that there is a higher plane and elevation to go to, that they can live from a point of vibrancy, of energy, and really learn how to love their heart and take care of their heart. And if they do that, then the physical health of the heart will just be there. It'll be a natural process, okay?
Wow.
Love your heart. Lean into the spirit, lean into the positive vibration, lean into the energy. Recognize and realize that you can have a spiritually vibrant heart, and then you don't have to worry then about the physical heart and whether you're going to have heart disease or not. I truly believe that. I believe that stress is the core of much of the disease. We know that for a fact. 90% of all diseases, not just heart disease and stroke, but diabetes, hypertension, cancer, immunologic disorders, they all have a basis within stress. And so my vision, quite honestly, is to bring that sense of inner peace, that serenity that I think that we all can have. And when you can get to that place of having that peace and serenity, no matter what's going on in your life, no matter what's going on in circumstances, it's just a beautiful, beautiful place to be. And that's where I want to bring people. I have such a passion for this. I have such a belief that people can make changes for the better. Okay? That when I talked to you earlier about discovering the diet program and making all these changes and impacting people and having more of an impact in their lives in that 1 year than the preceding 10 years of doing drug therapy. I was so jazzed about it that I was coming at people like a bulldog, like, you know, I have this thing. And what I came to realize is that you do have to meet people where they're at. You need to validate them for who they are and where they are. And all we can do as physicians is to educate and inspire and help move. But the biggest inspiration comes from really the patients recognizing and realizing that they can impact their own health. They can impact their whole life. And if I can inspire people to that action, then that's my purpose, that's my vision. And truthfully, that will never go away. You know, heart disease might go away, but people needing shifts in their life, people needing that guidance, that inspirational element, that'll always be there. I think that I've just found my voice, but in a different arena. And for me, if I can take this outside of my clinic, outside of the one-to-one interaction, which I absolutely relish, I honestly do. You know, I'm at my absolute best when I'm talking to that one individual one-on-one. But where do I think I can have the greatest impact? If I can get out and speak my message to the world.
So I just want to be really clear about the message, which is to practice the things that you discuss in your book, whatever avenue it is to get you to the present moment, to nurture your heart on a spiritual and emotional level, because your heart has cells similar to your brain, blowing my mind. You can actually heal yourself through those positive emotions, positive thoughts.
That's right.
I am absolutely contagious, a firm believer in this. Everyone needs to read this book, know what this book says. Thank you so much.
Thank you
for being here. Thank you so much for doing what you're doing on the planet. I know you're making a huge impact.
Thank you. It is my calling, it is my purpose, and I so feel that.
I believe it.
Thank you.
Thank you.